Hello everyone! Welcome to my YouTube channel. My name is Alona. So for some of you, if this is your first time watching this video, I am a retired community health nurse and maternity nurse, and I'm also a breastfeeding and lactation consultant. I'm a retired breastfeeding and lactation consultant, and based on my experience, marami akong mga mommies, nanays na umiiyak sa breastfeeding clinic namin because of so many problems in breastfeeding. So, isa sa pag-uusapan natin ngayon, which is very, very common na nangyayari sa community natin, is moms, mga nanay na gustong mag-breastfeed, at the same time, gusto ding mag-formula feeding. It's a mixed feeding na pag-uusapan natin ngayon. For me, yes, I am a breastfeeding advocate. I promote breastfeeding. Pero sa experience ko as a professional breastfeeding consultant and lactation consultant, I always put into consideration kung ano yung desisyon ng mom, because kayo yung nagsasacrifice for your baby. Kayo yung gumigising every 2-3 hours mag-breastfeed o mag-feed ng baby mo. So I respect whatever decision, kung anong decision nyo on how you're going to feed your baby. Ang importante lang sa lahat, the most important thing is that you are making the best na mapapakain niyo sa baby niyo. No matter what type of feeding method you're gonna be using, I applaud you for that. So today, pag-uusapan natin on how to breastfeed at the same time. At the same time, you are supplementing formula. There are many reasons why moms want to do that based on my experience ko. Some moms wants to have a break. They just want to have a break. They breastfeed whenever they can, and then they use formula whenever they can. Or they want their husband to feed the baby so that they can have a break. So, that's okay. That's okay. That's your decision. Some moms gusto lang mag-mix feeding because they go back to work and they're worried na hindi makakain masyado si baby if they're not putting any supplement. Or, kailangan talaga, sabi ng doktor na kailangan mag-supplement si baby dahil you don't have enough milk supply to sustain the health of your baby. Kaya mixed feeding. So there are many reasons kung bakit nagmi-mix feeding ang moms. And I respect you for whatever choices you have. Ngayon, pag-uusapan natin, ano ba talaga ang kahalagahan ng mixed feeding? And what are the best ways to do it? So based on my experience, as a lactation consultant, breastfeeding consultant, lagi ko talagang pinapaalala sa mga moms. If you're doing both breast milk at formula, always prioritize yung breast milk mo. I would want to see your baby eating breast milk first, bago ang formula. Let's say, sasabihin mo, as soon as you woke up in the morning, alam ko minsan sa morning, full yung breast mo because you probably have 6 hours break during the night na hindi na-stimulate yung breast mo. It's the best way to breastfeed right away. So, do not do the formula for your first choice. If you can breastfeed right away, go for it. Now, in the second feeding, if you want to say, okay, I'm just gonna pump later, bibigyan ko lang sa baby ng formula, go for it, okay? Now, I would suggest, kung ang baby mga weeks old lang, maybe 2 weeks, 3 weeks old, I would rather suggest start with small amounts of formula first. What that small amount? Maybe 10 mils, maybe 15 mils. So, ang 10 mils, so this is 30 mils. This is 30 mils. So, kung mag-start ka ng feeding ng baby na maybe 15 only for your formula, para hindi masyadong full si baby, and then baby will have the breast milk. Yun lang ang suggestion ko because I still want the breast milk to be the priority as compared to the formula, okay? So you can do that. Some moms will do, so this is 15, 20, so this is almost 40 mils. So 55 or 60. So you can do half-half. You can do half formula if you want, and then half breast milk. Whatever way you can do, as long as you prioritize yung milk mo. Now, for formula, there's not so much, kasi tinatanong mga moms, gaano ba kadami ang calories na makukuha ni baby from formula. So, artificial cow's milk. Normally, if you have 30 mils, ganito kadami, 30 mils, 20 calories dito sa formula ang makukuha ni baby. 20 calories. Sa breast milk na 30 mils, makukuha ni baby about 18 calories. So not such a big difference. Only 2 calories difference sa formula at sa breast milk. Again, ulitin ko, sa 30 mils na formula, 20 calories ang makukuha ni baby. Sa 30 mils na breast milk, 18 calories makukuha ni baby. Okay? That's a big difference. Now, anong dapat gawin ni moms? Let's say, kung si baby, there are some babies na pag binigyan mo ng breast milk, ayaw dumedi sa formula. This is so much problem, very common problem na when mom comes to my breastfeeding clinic na they cried for so much frustration dahil gustong-gusto nilang bumalik sa work. They're worried na pag they go to work, hindi didide si baby sa formula na isusupplement nila. How are you going to do that? Paano mo i-train si baby now? Take note, if you're going to work mga next month or 2 weeks from now, start mo nang i-train si baby. Okay? Some babies will hate the bottle. Totoo. They don't want the bottle, lalo na pag they're really used to your nipple. So, training your baby is very important. Kung ipo-focus mo dito habang nasa work ka, of course, bote ang pag-uusapan natin kasi kalimitan, the most convenient way. Kasi pag ika-cup feeding mo, it's a lot of work for some, and minsan, mas marami pa yung natatapon kaysa iinumin ni baby when you do cup feeding. But if you want to use syringe feeding, isa din yun na effective, na walang maraming matatapon if you use syringe feeding. Meaning, alisin ko lang yung tube, lagay mo yung formula milk dito, you can buy a 50 ml syringe. Ito din yung isang way kung ayaw talaga ni baby sa bote. This is one way on how you can feed the baby through this. So, how are you going to do this? You can watch my previous video on how to use this feeding method. Dahil marami akong videos about this, and I can show you again next videos. But we'll focus this one on the formula feeding. Now, so if the baby did not doesn't want the bottle, unti-unti mo siyang i-training. So what you need to do is during feeding time, kung gusto mong i-train si baby, stay away. Go to the kitchen, go to the bedroom, yung hindi ka makikita ng baby mo na nandiyan ka, so that the baby will learn how to use this. If the baby doesn't really like it, what you need to do is put the milk in here, either your breast milk or your formula milk, whatever you use for feeding. Put in here. Put it in the baby's chest. Kasi, di ba ang baby nagmo-move yung hands like this, nagmo-move yung hands? Let the baby play with this. Kasi, alam mo, maano talaga ang intuition ng baby. Pag naamoy nila yung gatas, hinahanap nila yun. So, either the baby, nagsisimula na tumataob, put this one always beside the baby. Pag nakikita ito ni baby at naamoy, kusa yun nila dadamputin. And they will learn on how to suck from the bottle. Slowly and slowly, just guide the baby, okay? So, if dad is there, or my lola, or my anak ka na older, na magte-train dito, and wag kang magpakita muna, kasi once every time nakikita ka, ang ma-imagine ng baby, it to latch on you, to breastfeed on you. So, that's how you can train on how your baby fell in love with the bottle and your formula or your breast milk. So, hindi madali ang pag-train ng baby on how to do mixed feeding, especially if you're going back to work, okay? Now, remember, when you do mixed feeding, never mix mo yung breast milk mo at yung formula milk mo. Never mix them together. Bakit? Based on research, nababawasan yung component ng anti-infectant. Anti-infectant, yun yung factor na nagpro-protect sa health immune system ng baby mo, bumababa up to 74% pag i-mix mo. Kasi nami-mix yung fat ng milk mo at sa component ng artificial milk, it decreases, bumababa yung effectiveness ng anti-infectant factor dito sa breast milk mo. So I hope naintindihan na hindi po pwede. Some doctors don't know that. Okay? So if your doctor never mentioned it, that means your doctor did not know that. Okay? So because again, hindi lahat na pediatricians, hindi lahat na nurses are have 3 years of experience for a lactation consultant, because to be a lactation consultant takes 2 to 3 years. So hindi lahat na doktor i-assume mo na alam talaga lahat about breastfeeding. So that's why I'm doing this video, kasi maraming mga nanays na they still confused kung ano yung sinasabi ng mga doktor. So I hope kahit papaano may konti kayong knowledge from a lactation consultant about breastfeeding na magagamit nyo ngayon on how you can decide to feed your baby using different methods. So, the method that I thought, you can do cup feeding kung medyo malaki-laki na si baby. Dahil pag maliit pa si baby, mas marami yung matatapon kaysa may inom ni baby. You can do bottle feeding, and I have a really good video on how to do bottle feeding. Please watch that, it's very important. And I also have a video on how to use different feeding method about how to use this, but I'll do it again. Ask me, put your comments down below kung ano yung gusto nyong mapakinggan o mapanood. Again, I could not continue this journey in my YouTube breastfeeding teaching if you don't support my channel. Please subscribe, like this video, and do the notification button so that pag may new videos ako, I'm doing videos every week, every day, every 2 days. So this will continue on and on until I get tired of talking about breastfeeding and pregnancy. So thanks again for watching and have a really nice day. Please don't forget to subscribe. I'll see you again sa next video.